Hi everyone, my name's Robin. This is my vlog. Today I'm going to explain the core values of social work and how they unfold in practice. There are seven core values, and they are service, dignity, worth of a person, importance of interpersonal relationships, integrity, social justice, and competence. So service is the main goal for social workers. Through this values, this social workers can help their clients with their needs and problems by seeking out resources and using their own knowledge and skills and values. The next is dignity and worth of a person. Social workers will treat their clients in a caring and respectful manner despite the individual's background. The importance of interpersonal relationship is the next value, and this value allows the social worker to investigate the individual who they're working with to see what the relationships are around them. And these relationships consist of their families, their friends, their partnerships, and even their work colleagues. If an individual does not have an adequate interpersonal relationship, then the social worker can help address this matter. However, if the individual do in fact have a great interpersonal relationship, the social worker may utilize this and and use the relationships to enhance the well-being of their client. Next, we have social justice. As social workers, we should challenge social justice by seeking change for those who are vulnerable and oppressed. Next is having integrity. Clients deserve a trustworthy and caring and respectful social worker. So there's this to show that they can come to them, or at least the clients can come to the social worker and help be confident enough that they are going to be treated fairly. They're going to be helped. They're also going to be trusted, where they're coming with their problems and issues. They're knowing that their confidentiality will be withheld to standard. Last one we're addressed is going to be competence. Competence is when the social worker would always seek out working on their skill set in their professional expertise, and this can be seen in different ways, such as going to school. It can be sitting in meetings with a supervisor, getting feedback. Another way is going to conferences and gaining more knowledge on the field that they're in. Last thing I would like to talk about is the complications of working with adolescents and children, right? So the complication of working with children and adolescents is pretty much like the when it comes to the consent phase. A lot of times the child who are minors are they can't really consent to a lot of treatment on their own, and obviously the social worker should know the the legal aspects when it comes to that. We should know what can be said and what not be said. There have to be able to get parental consent in some cases. Just seek, and then knowing what is ethical dilemma when it comes to children. Educating yourself on that can be a little complicated because laws the way the laws are can dictate one way versus another. For instance, there was an example in our textbook that states that a child who is sexually active and they can go get treatment for STDs and possible um, birth control and stuff like that without a parent consent. However, if a child's like in a hospital and they are needing treatment, most of the time they will have to get parental consent. So it just depends on the situation and circumstances as to how a social worker would combat that issue at hand. And this concludes my vlog. Thank you so much. Have a great day.